Welcome to PT Microlessons, fast lessons with big impact. In our previous microlessons, we learned the fundamentals of arterial blood gases, a step-by-step interpretation method, and how to identify compensation. Now it's time to put everything together by working through a few ABG cases. We will start by reviewing the four-step approach to ABG interpretation. First, determine whether the pH indicates an acidosis or alkalosis. Next, identify whether the PaCO2 or the HCO3 explains the pH change. That tells you the primary disorder, which will always be one of four possibilities: respiratory acidosis, respiratory alkalosis, metabolic acidosis, or metabolic alkalosis. Finally, determine whether compensation is present by asking whether the secondary system has changed to help restore the pH toward normal. Compensation may be absent, partial, or complete. Now let's apply these four steps to some clinical cases. Throughout these lessons, we've used the midpoint values of 7.40 for pH, 40 for PaCO2, and 24 for HCO3 because they make it easier to identify the primary acid-base disorder. However, remember that ABGs are reported as ranges, not single values. Once you've identified the primary disorder, you'll need to use the normal ranges when determining whether compensation has occurred. In particular, a fully compensated disorder will often have a pH that has returned to the normal range, even though the PaCO2 and HCO3 remain abnormal. So think of the midpoints as your guide for identifying the primary disorder, and the normal ranges as your guide for determining compensation. Okay, let's work through this case together using our four-step approach. First, look at the pH. The pH is 7.33, indicating acidosis. Now determine what could cause an acidosis. There are only two possibilities: an elevated PaCO2 or decreased HCO3. In this case, the HCO3 is 18, which is low, explaining the acidosis. Therefore, the primary disorder is metabolic acidosis. Building on that, we need to complete the last step by determining whether compensation is present. Because the primary disorder is metabolic, the respiratory system is the secondary system. The PaCO2 is below normal, indicating the lungs are compensating by blowing off carbon dioxide to help raise the pH. However, the pH remains below the normal range of 7.35 to 7.45, indicating partial compensation. Thus, this ABG represents partially or acutely compensated metabolic acidosis. Let's try another case. This time, I'd like you to work through it on your own using the four-step approach. Pause the video, determine the primary disorder, and decide whether compensation is present, and if so, whether it is partial or full. When you're ready, continue to see the solution. Now we will walk through the answer together. The pH is 7.53, indicating alkalosis. There are only two things that can cause an alkalosis: a low PaCO2 or an elevated HCO3. In this case, the elevated PaCO2 cannot explain the alkalosis. The HCO3 is elevated, which does explain the pH. Therefore, the primary disorder is metabolic alkalosis. Now determine whether compensation is present. Since the primary disorder is metabolic, the respiratory system should compensate by retaining carbon dioxide, thereby increasing PaCO2. The PaCO2 is 52 millimeters of mercury, so compensation is occurring. However, the pH remains above the normal range, so the compensation is only partial. This ABG represents partially or acutely compensated metabolic alkalosis. Here is our final case. Once again, pause the video and use the four-step approach to determine the primary disorder. Then decide whether compensation is present and whether it is partial or full. When you're ready, continue to the next slide to check your answer. Let's work through the answer. The pH is 7.36, which is within the normal range but slightly below 7.40, indicating the patient is on the acidotic side of normal. There are only two things that can cause an acidosis: an elevated PaCO2 or a decreased HCO3. In this case, the elevated PaCO2 explains the pH. Therefore, the primary disorder is respiratory acidosis. Now determine whether compensation is present. Because the primary disorder is respiratory, the metabolic system is secondary. The kidneys compensate by retaining bicarbonate, causing the HCO3 to increase. In this case, HCO3 is elevated, indicating that compensation is occurring. Since the pH has returned to the normal range, this represents fully or chronically compensated respiratory acidosis. Let's finish with a few key takeaways. First, use the same four-step approach every time you interpret an ABG. Having a consistent process helps prevent mistakes. Second, remember that there are only two possible causes of an acidosis and two possible causes of an alkalosis. Your job is to determine which one explains the pH. Third, always identify the primary disorder before looking for compensation. Once you know the primary disorder, you automatically know which system should be compensating. Finally, use the midpoint values to identify the primary disorder, but use the normal ranges when determining whether compensation is absent, partial, or complete. With continued practice, you'll begin to recognize these patterns quickly and confidently. That's it for this PT microlesson. Like and follow at PT Microlessons for more fast lessons with big impact on physical therapy topics.